Welcome to the Ultimate Dental Podcast, the place where you can learn how to create a dental practice and a business life that you love. Listen in with Dr. David Moffet as he interviews successful entrepreneurs and successful business people and successful dentists as they share their business successes, their stories, and their breakthrough ideas, sharing pearls of wisdom that you can take back to your practice and implement immediately so that you can have that great practice with more patients, higher profits, and less stress. This is the podcast where great dental practices meet with successful business processes. Thanks for tuning in to the Ultimate Dental Podcast, the podcast where thought leaders, industry experts, and thriving practice owners reveal their very best tips, tools, and strategies that will help you grow your dental practice faster. Now, here's your host, Dr. David Moffet.
Hi, everybody, and welcome to today's episode of the Ultimate Dental Podcast. I'm your host, Dr. David Moffet. As you know, I'm in Burrowing, New South Wales. It's just gone 11 o'clock Wednesday morning, and it's great to introduce to you my guest in the studio all the way across in Mexico. Yeah. Dee Dee Reid, who's not a Mexican. She's actually an American. But Dee Dee, welcome to the Ultimate Dental Podcast studio. Thanks for joining me.
Thank you. Thanks for having me. Excited to be here.
Now, we've been, as we were talking beforehand, we've been known to each other for a long time, but we've never actually spoken until this morning or
Right.
today. But we've been, I guess, observing and admiring, or I certainly have, what you've been doing in the dental field. And so when I started the podcast a year and a half ago, I thought this is somebody that I do need to hear their story, and I want to share that story with my viewers and listeners. Thank you very much. You've been in dental pretty well most of your working life. Is that correct?
Yes, 37 years since I was
So,
18 years old.
okay, anybody out there with a mathematical brain will now know how old you are. So, but you know, I've got my date of birth on my Facebook, so they can find that too.
Right.
Tell us the story. Tell us how you got into dentistry, and because your journey through dentistry is a really amazing one, and it's a path that anybody can take. You know, somebody who's going to be watching this or listening to this might be a practice owner, might be a dental employee, and say that will suit me, or that will suit one of my employees. That person has the ability to do what Dee Dee has done. So, Dee, let's hear that story. How did you start off in dentistry, and tell us about the progress you've made, because it's spectacular.
Thank you. So in 1989, I started working as a dental assistant for an endodontist as an after-school job my senior year in high school. Thought it was just going to be a fun thing that I didn't have to work nights and weekends. I worked from 3 o'clock to 6 o'clock, and I wasn't the main. His main assistant was there, all morning, and then I filled in when she went to go pick up kids from school. I worked as a dental assistant all through college, and then I started learning the business side of dentistry, which was really interesting to me. I love psychology, and I love the science of behavioral science, why people do what they do, and learning all the systems. And I just have a knack for numbers and for people. And so as I grew in my leadership skills, I actually went to a transformational training on the advice of a hygienist, a friend of mine, and started doing I did all the courses, and then I started coaching for them. And I did 18 years of volunteer work where I got all of my coaching chops. And through all that, I also, after being an office manager, I really enjoy being a patient concierge, and so treatment coordinator. And I started doing that in 2005 and working for a dentist who does a lot of high-level dentistry, and was really having fun with that. In my journey, started also speaking for Invisalign, and they had me travel all over the country speaking. So at that point, I was like, I really enjoy this, and I had met a dental consultant back in 1994 and was like, hey, when I grow up, I want to be like that. And so one thing led to another. I met Dr. Mark Montgomery, and he and I had a conversation over dinner one night, wrote my business plan because I said I wanted to take what I've learned in my coaching world and bring it to my dental peeps, because dental people are my people. And so that was kind of how that got brought together. And then, he was speaking, doing a occlusion course, and he introduced me to the whole room as a dental consultant. And then the rest is history. We formed Amplified Dynamics back in 2014. So he and I have been working together since then, he works more from the clinical side and I'm more from the business side. And then I created Patient Concierge Institute, where I work primarily with treatment coordinators, what I call patient concierge, working with new patients, where we take over the entire new patient process, where we do the interview, talk about dental history, medical history, their values, their goals, and get the patient all of their records and get the patient ready for the doctor. And I teach that process through Amplified Dynamics so that, you know, it's fun to do dentistry, one-tooth dentistry, but not as fun as when you're doing smile designs and full mouth rehab, where we're doing life-changing dentistry. And that's really where I feel like we make that deep connection, those deep relationships with patients, and where the dental teams and doctors get all of the fulfillment and the kudos that you don't get when you just do number 30 crown prep. It's like, it's not the same thing as, when you get to do the big reveal and show them their new smile or show them their new occlusion so that they can eat again, and be with their friends. So that's been my journey. And I coach doctors and teams from all over the country in the US, and to have them, work on systems and communication and how to best serve the patient from a relationship focused perspective.
So, how did you come across the idea or the concept of a patient concierge? Because 99 dental offices out of 100 would not have that thought, let alone have that role in their office. Is it something that you saw outside of dentistry, or it's just something that you saw in dentistry one day and you thought, hang on, this should be more utilized than it is?
Yes. So the doctor I was working for in Dallas, he saw potential in me and said, I want us to go to a treatment coordinator course specifically for you to help redesign your role here. And in that practice, I started out as an office manager, and then I ended up having 3 different desks over the course of 10 years because we kept reinventing my position. In the course, I was like, okay, how can we create you have the ultimate dental podcast. How can we create the ultimate dental experience? And my goal in every interaction with new patients is that they would want to hug me before they left. Like, that was my goal, so that, we had that connection, so that they do have trust. Nobody wants to go to the dentist, right? I mean, we hear that all day long, every day. And it's like, how can I create an experience such that they want to come back, that they love us, and that they get the dentistry they deserve, And it's not about us giving them a list of things that need to be done, but it's really tailored to what their values are, what their goals are, what's most important to them. And then when you present a treatment plan that matches that, it's an easier yes than, I have patients all the time that will come in and say, Dee Dee, you're not going to do 10 crowns on me. And I'm like, okay. I go, you're in the driver's seat. You're not going to do that Invisalign thing. Ends up, that particular patient, we did 11 crowns on her and Invisalign and a full mouth rehab on her husband. So it's like listening deeper than just surface level. And I have a whole process for that. And it's been a process that I've developed over the years to have it where it works for patients, and that we make sure that we are getting into a relationship with them. I feel like if we work in a very intimate area of the body, this is where people speak their truth. This is where they nourish their bodies. This is how they interact with the world. And this is how they kiss their partners. It's like, and then we're going to come in here and invade it with drills and needles and everything. It's like, and we don't have a relationship before we start this. It just sounds backwards to me. So that was that was kind of the impetus to me having this process so that patients feel completely comfortable and that they trust us and that they want the dentistry. I want people to beg me for a root canal. I want them to beg me for dentistry versus them feeling like someone is trying to do something to them. I mean, that to me is gross. And, that we want to do that Invisalign thing, or we want to do those 10 crowns. It's like, that has no place in my heart of being in service to people. So that's
You're absolutely right. It comes down to that first primary feeling of trust and respect that the patient needs. And, I identified in my office that you can be the best dentist in the world, you can have the best people answering the phone in your office, but if there's forever some reason for delay and you've got a patient unattended in the client lounge, they're going down a slippery slope into a rabbit burrow that they can't get out of. They might see something, hear something, or just conjure something in their mind as to, I really don't want to be here. And they will close off to the dentist before they even meet the dentist. And so having a treatment coordinator, having a concierge, and we spoke about this, I asked my wife to come and be my concierge at my dental office. She was a school teacher before she had children. And
Mhm.
when she felt like she was looking for something to do, I said, this is the role. Just come in, chat with people, keep them on that level, that excitement level, so that they
Yes.
don't go down and then have to come back up. And
Right.
it works wonders. But what you describe, that journey of the patient, saying, I don't want this, but they got it. Two thoughts came into my mind. One is that there is a lot of unpresented, undiagnosed dentistry in the filing cabinet.
Sure.
I heard that 2/3 of patients of a dental office have some form of crooked teeth that can easily be fixed with aligners. Not
Sure.
with braces, but just with aligners. 2/3 of them, 2 out of every 3 people have something that's never been presented to them or asked, would you consider? There's another 2/3 who have a sleep disorder that they
Yes.
can wear an appliance that would
Yeah.
help them sleep in the same bedroom as their partner
Yeah.
without having their ribs broken, or vice versa, or having to break the ribs of their partner. So
Right.
again, this is unpresented dentistry from people who trust. But you're right, you've got to build that trust first.
Mhm.
You can't just be a dental panel beater, as I used to call them, just fix, what do you say, one and done, and they're gone
Yeah.
until next time.
Right. Until
That's not a
next.
relationship.
And it doesn't get to the root cause of where their disease has started. It's like we're patching things here and there. It's one and done until next year, and then it's the next problem. But really asking questions about, do you want lifetime dentistry? Is this, have you had issues your whole life? Would you like it to be different? Would you like your future to be different than your past? It's totally possible. And they're like, wait, what? No one's ever talked to me about that. But if you don't set aside the time and have a team member that can spend the time and empathize and ask the right questions and present their photos up on a big screen so that they can see what we see. Like, I never want a patient to just trust us. I want them to see what we see. And then they can make a great decision about what they want to do or not do. At the end of the day, it's them that goes home with what's going on in their mouth. And, it's our job to show them what is possible. And then they can make an educated decision. I like to, I guess I like to be in control of things. I could say control freak, if you will, but I like to have choices in my life. And it's like, if we present people with choices and options that meet their values and their goals, then it's an easier yes.
Well, often the role that you describe is not so much giving them choices or options. You're actually giving them something that they've never heard before.
Yeah. Which
They've
is super
come
fun.
to, yeah, and it is. It's like, did you know we can do this for you, and this is how you're going to look and feel as a result. And as you mentioned too, being dentists treating patients pathologically, like, this is wrong, let's fix it. This is wrong, next time, let's fix it. That's not the answer. It is, what goes on in here is an illness, is a disease, And it's not just an isolated part of the body that you can just take out and it doesn't affect the rest of your body. You know, that whole thing about the blood pumping through your bleeding gums is also infected gums is
Affecting
also
your
pumping
heart
through your
and
heart, your lungs, your brain, and your baby.
yeah,
All these things. Is it? Yeah. Well, of course it is. And so
yeah,
we've got to, and not only is it a window to the
reciprocity.
rest of the body, it actually causes things in the rest of the body. We're now finding that with the work on, we're getting a bit scientific, but the work on P. gingivalis and how it can lead to an increased risk of dementia if you've got an increased concentration of P. gingivalis being produced in your mouth. It's not just a separate compartment. Oh, that's my mouth. It's not going to hurt the rest of my body. But let's get back to the treatment coordinator role, because I love that, because dentists are often trained in dental school down under, especially, and in some schools in the US, that they are the authority. So they have to be there from the moment the patient comes in. You haven't had a clean, you need to see the hygienist, as opposed to, like, we can all know you haven't had a clean for 12 months. Probably best to see the hygienist before you see the dentist. Well, like
Yeah.
that, is that really a standard of care issue? Some schools say it is, but keeping the dentist at the back so that he becomes really, now here's Dr. Smith. He's the one who's going to be doing the dentistry, but they've already been sold they've already been made the decision that they're going to get their dentistry done here because they love everybody who's helped them along the way.
Yeah. Well,
And
right. And
that's
the
the
dentist
focus.
gets to come in and be the expert and gets to be, the hero. And so, during that hour and a half, 2 hours that I have with a new patient, I'm building up this dentist going, oh my gosh, well, that's exactly what doctor is brilliant at. These are his primary skills. And so we're absolutely going to take care of you. And so, yeah, and the dentist gets to come in and be the hero, which I love, and I get to be the hype person, and to create the enthusiasm. I believe that the enthusiasm that I have is when I am able to transfer that to my patient, that's when hope becomes alive in them. That their future can be different than their past. That their future possibilities, conversations are my favorite conversations to have. And so it's like, can I paint the picture beautiful enough that they go, that's what I want. I've had a full mouth rehab myself. And so I can speak to that, the importance of it, the reasons that I had it. I had an anterior open bite for many years and was grinding my posterior teeth and had TMJ and neck and head headaches and neck and shoulder pain from all of my bite being off. But, for years, I didn't know that was the issue. Um,
Mm.
until I started hanging out with some really cool dentists that, that's their specialty. Now I've not had a migraine in 25 years. So pretty cool.
You're a great advertisement for comprehensive dentistry,
Yeah.
and the cosmetics is just a bonus, right?
It
It's
is.
really,
It is. It
it
is a
suits your
bonus.
vibe.
Yeah. I'm also have a sleep. I'm also a sleep patient. I wore a CPAP for 5 years and had a tongue tie release and was getting ready for double jaw surgery.
Oh,
After
wow.
my Yeah. So we were trying to create more oral we were gonna create more oral volume in my mouth, and I had a posterior tongue tie release, and the ENT in LA said, "If you continue with your myofunctional therapy and be religious about it, you go get retested with your CPAP." He said, "I predict that you can set that CPAP aside." And that actually happened. I did 6 months following my procedure. I did 6 more months of myofunctional therapy. Now I don't have to wear a CPAP anymore, which is super cool.
Wow. Wow.
I was I was looking for a curative measure to get me off the CPAP, and I lost a bunch of weight, but then even after I'd lost a bunch of weight, I lost 140 pounds. After
That's
that,
another human being. That's
I
another
did.
human being.
That is true. That is true. But my blood oxygen was still dropping to 78% without my CPAP. So
Mm.
then they called it skinny woman syndrome. I'm like, really? Like, that's what I got to deal with? But after having my tongue tie release and doing my myofunctional therapy, changed my life. So it's totally possible.
That patient journey that you described, where the dentist comes in to be the hero and has been presented as you're going to be in the best hands, and he'll come in at the end as opposed to come in at the start and start diagnosing. And so the pre-diagnosis done by qualified members of the team is an important thing. And dentists sometimes miss that. The general dentist says, "Well, I can't. How can I make that conceptual leap?" But really, a good hygienist knows exactly what they're seeing, and whether they're allowed to diagnose or not, they can tell the dentist what they see, and they can tell the patient that the dentist may do this and that or that, but,
And
give
that's exactly
options.
what I do when we're looking
Yes.
at records together. It's like, I'm not a dentist. However, when I worked in dentistry for a long time, and these are the things that I see. But when the doctor comes in, well, he'll confirm, whether this is the appropriate treatment for you moving forward. And
Mm.
so I'm not diagnosing, I'm just letting them know that there are options, that in this case, he might recommend that we do some aligner therapy, but I'm not diagnosing. I am holding the hand of the patient and helping them down that pathway, leading them
Yep.
to a better future. That's how I see it.
Mm. Very much so. I experienced that same journey as a patient of an ophthalmic surgeon way back
Hmm.
and I had an ophthalmic surgeon in my building and where my dental practice was, and I read articles that there's this laser eye surgery coming out.
Hmm.
Yeah, and I said, "Yeah, I've got to get that. I don't want to wear glasses all my life." And so I went downstairs and they said, "There's two choices, PRK or LASIK." And they said, "LASIK's very dangerous. You've got to use a keratome and cut the flap and then you've got to put it back. Whereas PRK, we just scratch the epithelium off and it just regrows, much safer." So I had PRK. It hurt like heck. Like for 2 weeks, I couldn't
Wow.
go out for a month, I couldn't go out in direct sunlight, and I get to work, 5-minute drive, and my eye would water from the direct sunlight. And I said, "I'm not doing that for the other eye." So I went to another surgeon across town purely on the recommendation of a weekend newspaper story that he had done some footballers. And my journey there was exactly how you are describing the patient journey in your dental office, that I met, I had my eyes measured. I'd met so many people. By the time I met Dr. Hughes, I'd already made the decision, this is where I'm having my work done. And I think that's really what a great team does. And although it was just routine run of the mill eye surgery, it did a video of it's funny. I've got a tape of a video, and you watch this. It's like when you go to the deli and they slice the ham. It goes zzz across, and then it
Yeah.
lifts the fat, and then they put it back, and it just rejoins. It just rejoins with the fluid, and that's just so cool. And
Hmm.
but that whole journey, and I'll end this by saying I talk to my clients all the time about this, and I say, there's a movie like this, and they go, "What about the patient journey?" I go, "No, there's a famous movie that describes this process in detail, and you're missing it. You're missing the message." And the movie is The Wizard of Oz, because by the
Yeah.
time Dorothy meets the wizard, she's already sold on him being the only person who'll get her back to Kansas. She's done the
100%.
journey. She's got to stay on that yellow brick road, get to the end result, and then he's going to get her back to Kansas. She doesn't even know how, but
Right.
she's sold
Right.
on him. And if
Yeah.
we can create that Wizard of Oz sort of journey for our patients, where everybody has a role to play, as opposed to just relying on the dentist to come in and do the sale, because dentists aren't good at that. They're often good at just the technical stuff. But yeah, that I like sharing that story because people go, "You know what? He's right. It is the Wizard of Oz,
Yeah.
not all this new stuff. What is it? Wicked."
Wicked.
Like,
Yeah.
my wife
Wicked.
says, "Oh, you gotta watch Wicked." I said,
Wicked for good.
"Wicked's like kind of making up stories that don't." Yeah, this was what happened that led to the Wizard of Oz. I said, "No, this is not what the Wizard of Oz was about."
No.
But anyway, it's lovely that you're in that environment, and so you get that whole thing that you're helping people to have a better life as a result of getting the dentistry. Yeah, and whether it's just straightening their teeth or a full mouth rehab, they get the functional aspect of it. That's the benefit that they don't even realize.
Right. They don't even know that they don't even know. Yeah.
Yeah,
Yeah.
I remember I did some Las Vegas Institute work, and so I had to find a
Yeah.
patient. I had this guy turn up. His interdental height of his central incisors, he was worn down to 1 millimeter from the papilla, and he was so
Wow.
worn down. And he says, every time I go to the dentist, everybody, he gets all the stuff in, they just laugh at me. Look at this guy, look how much he's worn his teeth. I said, well, we've got to open you up first so we can create the space.
Yeah.
And he said to me, he said, that thing that I'm wearing at night, he said, all of a sudden I'm sleeping better. He said, I thought I just couldn't sleep because I was getting old.
Yeah.
And so he
Yeah.
was sold on
It's
what he was
like
going to get. Yeah, and we made him look we also made him look like a very handsome man too, like with the new teeth, which
bonus.
was
Yeah.
life-changing. Yeah, and it was life-changing for me because I worked out a payment plan for him throughout that whole thing, and if I hadn't done that, I probably never would have gotten that first full mouth case to learn the skills that then helped me with other people.
Yeah.
Sometimes you
Well,
gotta
and
look at
and and that's a bit so I'm glad you brought the finances up. That is a huge barrier for a lot of people. And, working in the front office, at a dental office for many years, it's like, how do we help people afford dentistry so they can say yes? Because you can diagnose stuff all day long, but if they can't afford to find a way to be able to pay for it, then we're wasting our time. And so, I believe that we should have multiple sources of, ways to help patients move forward. I put together a 34 ways that patients could pay, have a document somewhere that I put together that, um, all the different ways that would support a patient to do that. Now, I know that sometimes people go, oh, well, we have Care Credit or we have Cherry, but how many others of those do you have and available to your patients so that, if we can't get them approved for Care Credit or we can't get them approved on Cherry, what are your other options? Because the worst is when they walk out the front door because we couldn't get and figure out the financial stuff. I know patients, that's one of the first questions they ask, well, how much is it going to cost? Well, until we know what you want, what is best for your long-term health, and what's possible, I will talk about the finances with you, but until we have a solid treatment plan, it doesn't make any sense to talk about it. I said, because I could be sitting here just making numbers up otherwise. But I feel like it's on the team to figure out, be as creative as possible. I had one patient who had grandma sent a check. She had dad sent some cash. We put part of it on a credit card. We did part of it on Care Credit. We did part of it on another financing company. And it took 5 different sources in order to build enough, all the money to make it work. And what I know is that we changed that patient's life because I sat there and continued to be creative with the patient. It's like, we've got to help them find a way. It's like, we got to help the patient want the dentistry first. And when they want it, then the way becomes easy.
It's interesting because you solved a problem by putting a whole pile of stuff together. Often I find when talking finance, just general finance with dental staff, is that as soon as the patient says, oh, that's too expensive, the staff default to, we must finance the whole amount, as opposed
Right.
to, well, how much have you got that we could start with? Then you're only got to finance the difference. And that can be that can be bizarre. In fact, my wife had a conversation once with a patient for a $2,300 crown, and the patient goes, oh, I can't afford that. And Jane said, how much can you afford? And she goes, I can afford 2,000.
Hmm.
So all of a sudden it was about the 300, not about the whole 2,300. By the end of
Right.
the meeting, and they chatted about a couple of other things, she goes, you know what, I can put that other 300 on another card. Let's do it. And so the finance didn't even become an issue. Often the default is straight to a finance plan, and that's kind of like hitting rock bottom and then trying to get back to the surface. It's just not, let's just not default there. Start with the difference and
Right.
and and
And
we
and
can get
being
going.
and being bold enough to ask the question, what could you afford? How could we start? I have patients all the times that would ask that would say, well, I just need to think about it. My response to, I want to think about it, is tell me what it is that you're going to be thinking about. Maybe I can help you with that. My job is to help them figure out the way forward. Our job as dental team and doctors is to help the patient figure out a way to make a great decision, because the enemy to that is indifference, is, well, they can't afford it, or, it's always about the money, or It's they don't see the value. I hear that from doctors all the time. It's like, well, that, not in my town would anybody do a smile design or a full mouth rehab. And I'm like, well, yeah, give me a schedule of new patients and I'll come to your office and I'll show you different. And that's what I do when I'm doing patient concierge training is I want 4 new patients and then I will do my whole patient concierge process while the team is there interacting and watching the whole process. I in one particular office in 2 days, I sold $110,000 of treatment. The following Monday, the team closed an additional 80 grand. And it was all by, I was showing and telling, I was like doing my process so that they could see how not complicated that it is, but it's about asking questions to their questions. And, how much is this going to cost? Well, tell me, is cost a concern for you? Cool. Well, I will make sure that we have all of the options available for you in order for, whatever it is that you need, that we've got that handled for you. It's anticipating their objection before they have it and or creating removing a roadblock before the roadblock actually appears.
Yeah, I love how you do that because most people will, in a dental office, most people in sales will take the first objection as being gospel when it's often just a smokescreen and it's unclear. And when I say smokescreen, it's not a brick wall, it's just a
Right.
diversion. It's a
Right.
it's a hesitation that they put in front, hoping that you will recede. But
Mhm.
the answer it lies beyond that ghost as they put in front of you. Tom Hopkins, I think, used to call it a ghost. Everything is either real or a ghost, and most things are ghosts. You've got to find the
Mhm.
real objection. And Dick Barnes used to do it. When they say, I need to think about it, he just used to rattle off. He said, what is it? Are you worried about how good you're going to look? No, 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 I can see that. Are you worried about my technical skills? Because if you're worried about my technical skills, oh, no, 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 we trust that you can do it. Well, if it's not your good looks or the technical skills, what is it? And they go, it's the money. And they
Right.
blurt out the real answer. And then you can just solve that. Much easier to solve it once you know about it, once they've said it rather than you say it as well.
Right. And that's super powerful. It's like when I love having the patient vocalize what it is that's important to them. It's like when we look at photos together, it's like they look at their mouth on the big screen and like, oh, that's gross. And I'm like, well, tell me what's gross about that. What are you seeing? I want to see the photos through their eyes and then make notes about it. So when my doctor comes in, I'm going to take notes as we're talking through these photos. So my doctor knows exactly your thoughts and feelings about what you're seeing and what questions that you have, and I can help maybe answer some of those. And then when the doctor comes in, they can answer the rest. So it's asking great questions and really listening to the music behind the words. Make a big sigh or they have tears. One of my favorite things is when a patient's crying, I don't want to shush the tears. I want to know, what are the tears about? I go, it's okay. We cry in here all the time. It's not a big deal. And I'll hand them a tissue. But tell me, what are the tears about? And they're like, oh, I'm so embarrassed. Oh, my mom paid all this money for my ortho and I've screwed it all up and I'm embarrassed in my mouth. And look at that picture. I've messed up my mouth. And I go, you're in the right place. This is what we do every
Love it.
day. I'm honored that you're here because this is what we love to do and we get to take care of it together. So I'm going to hold your hand through this whole process so that you don't have that embarrassment in the future, so that your future is exactly the way you want it to be. So when you come into the dental office, you're not afraid anymore. That you come in having confidence that things are solid and healthy. I mean,
It's, it,
I think the biggest questions for patients is the fear of the unknown. Are they going to hurt me? Are they going to, take my whole wallet? Is it going to be something that I'm embarrassed about, afraid of? And then if we can clear that fear, then we've created a connection. And I think people are starved for connection, especially in
all the
our whole, cellular world, being on our screens all the time. It's like having a human holding their hand and touching them on the shoulder and letting them know I care is true caregiving. And that's what we do in the dental practice is caregiving, not treatment planning and, all the rest. It's like, how do we take care of this person the way we would want to be taken care of? Special, VIP, important, that they feel heard and seen and known. The rest is easy.
That's it. The number one reason patients leave a dental office is because they feel they aren't being heard, that they're being taken for granted, and they're being ignored.
Yeah.
And so what you described is the exact opposite. We've got to focus on making sure they do feel like they're the most important person. Mary Kay Ash said it best, didn't she? Everyone's walking around with a sign around their neck that says, "Make me feel important." Nobody can see it, but it's there. It's invisible. And we've just got to remember that whenever we talk to people, they're the most important person is that person in front of us. And it's all about them, not about us. Not about
us.
Yeah.
In the dental world, we make that's a huge mistake that I see practices make all the time is we start talking about procedures. Nobody cares about procedures. They care about their quality of life. How are we going to change their quality of life? What's in it for them, not the procedure. Talk about procedures with your dental friends, your dental buddies, not procedures with patients. I think that's a big stumbling block for a lot of people. I mean, I think it's drilled into you in dental school that, procedure. And so it's like, I think dentists love to talk about that stuff because it's cool and fun and clinical, but patients don't care. They want to talk about their family. They want to talk about being able to sleep in the same bed with their partner because now their partner doesn't snore and keep them awake. It's crazy, the psychology that we need to embrace so that we really can take care of people on a human level, not just a procedure.
It's a learning shift that dentists don't get taught at dental school.
Yeah.
You hear that all the time. They don't get taught business skills. They don't get taught
Yep.
people skills. They don't get taught sales skills, marketing skills, HR, employment skills. But back to the one, those people-to-people skills, if you can manage those, if you can develop those, and everybody has to develop them because as far as I have researched, I've never heard of any baby being born that can speak. So everybody has to learn how to speak. We all start off on a level playing field. So it's that, how do we do that? And some of the great speakers of the world have blooper videos of how bad they were to start off with. So if they can do that. And
I have blooper videos. So as I was learning this role, I videoed myself in the consultation room with the patient. I didn't have the video camera on the patient. I had it on me. And those are scary videos, I'll tell you. I used to do weird stuff with my hands and weird stuff with my mouth and face. And I was like, what in the heck are you doing? Those are the ways that we learn. I call that game film. Every professional athlete studies their game film. So my challenge to dentists, to dental teams is, are you taking game film? And if so, what are you doing with it? Are you utilizing it in a way to help you get better? I mean, we did it for years when we would record phone calls, but then you still have to take the time to go and listen to the phone calls in order to get better at your communication skills. So I absolutely love doing video so that we can learn and be better.
Well, it's logical. I'm a big fan of the musical Les Mis. I've seen it. I've seen it in New York, Broadway. I've seen it in Sydney, in Melbourne. I've seen it in London. I've seen amateur versions. I just love it. But the principle is that if you see it 2 nights in a row, guess what? They're standing in the same spot. The barricade's in the same spot. Because that's where it's meant to be. And yet in a dental office, they'll stand in different spots and different distances and say different stuff. And they go, why are we getting different results? Because you're not following a playbook.
Right.
They need a playbook. They need to practice.
Yes.
And if you do those and you need a professional coach. Those are the 3 Ps, professional coach, playbook, and practice. Yes. And that will make you better. And so you find out what works. You videotape, as you said, and you see what works. And then from that, you then improve.
Practice.
You say, I need to do this. I need to do this. We did it when I started refereeing rugby. Same thing. You got to watch yourself back. What am I doing over there? I should be over here.
Yeah. It can be as simple as practicing one question with a patient every day. For my clients, I would challenge them to write whatever the question was on an index card and put it in their lab coat. And before you walk into a treatment room, you pull it out and go, okay, I'm going to start using this question. And then you work it into your routine, so then it's not weird the next time. And it's not, it's like it can roll off your tongue a little bit better. But I mean, give yourself some practice time, and you don't have to know all the questions and all the things, immediately. It's like, let's work on them one at a time. Just like taking x-rays, taking a photo. Those are all things we had to learn. And we, kind of sucked in the beginning. We're all going to suck at something new, just the way it is.
If you practice and you follow what works, you're not trying to reinvent it yourself.
No.
You will get better.
Totally.
And that's the beauty of business and dentistry. If you don't want to be in business as a dentist, go and work for a government. Even if you work for a DSO, they're going to make you work in a business sense because that's a business. But if you want to purely be charitable about dentistry, you can do that. But other than that business of a dental office has to make a profit for you as a reward for being an owner, as a reward for your study, has to make a profit that you can spend back in the community, that you employ people from the community. It's part of the ecosystem of the Western society. If we don't have small business, we don't have big business.
Right.
My
heart is with the private practice dentist. It's like that one-on-one relationship with the patient and the doctor and the team is irreplaceable, special. If we choose it to be that way, I mean, there's practices out there that they want to be on roller skates all day and not know their patients and not be known or have their patients feel like they're known. That's just not my style of care. At the end of the day,
No, yeah,
want to connect.
I bought my office in January 1987, and I left it in 2014 after selling it in 2007 and still working on in it. So 28 years in the one place, and grew that office dramatically. That was more than half my life when I left. But it was those relationships with those people, the stories, people, one of my patients told me that, and I tell this story about the Blue Mountains west of Sydney, is a narrow road highway along a ridge, and basically it's national park on both sides. So if there's a fire, you are in trouble. The communities could be, if the wind picks up, nothing's going to stop that fire. And one of my patients said about his daughter, he said she rang me. Now, his daughter was a little girl. I did her orthodontics before she had all her permanent teeth. And he said, she rang me. She said, she was on the roof. She said, Dan, I'm just on the roof of the house. I just wanted to let you know that I love you. And he said, fortunately, she survived that fire. But, whenever we talk fires down here, I've got another cousin. I have a cousin who lived up there. She said, David, I lived there for 7 years. It was like 27. Every time I saw smoke, it just took years off my life. And so, but that story about what Tom said about his daughter, Megan, I thought, you don't get that from just being a patchodontist, one and done dentist. And, you've always got those patient stories and getting down to, the thing, what have we got in common with these people? And it's not about us, it's what they have. And so, I've done that. I've lived that. I know that feeling, and that's the trust that you build. And I love that you've turned this into a role that you now not only have done, but you are now teaching dentists. You've mentioned it a couple of times, but tell me, and we'll put how people can get in touch with you, but if somebody approaches you and says, I like your role, I want to implement that in my office, what's the process they then go through? Because, it's obviously a benefit for their patients, the community, that practice, that team, to be doing something different, better, and beneficial. How do they put up their hand, and what's the process from putting up their hand when they contact you?
So I start out with a Zoom call, and we talk about, what they want that's different. And I practice what I preach. So like I treat the new dentist exactly the way I would treat the new patient. So I'm asking questions and I'm listening and I'm taking notes and I'm, helping to diagnose what is needed. So then I can create a process for them. Usually I go to the office, I spend a couple of days, we see some new patients, we see a new patient, then we debrief. We see another new patient, then we debrief. And then usually on the third one, whoever that team member is going to be, we do that one together and then we debrief. And then we do the fourth one, usually that new person, whoever the treatment coordinator is going to be. I sit back and I am listening as they are, doing it live. And, and we record everything while we're there. So then you have all of the things that all of my languaging, all of my questions that I ask. I have 100-page workbook that I have put all of this in a workbook. So it is a step-by-step process. And, it's not super rigid. It's like we can edit it to make it work. I also use the new patient process out of hygiene for hygiene patients when we're doing their next comprehensive exam. We can take a comprehensive exam out of hygiene and do the same exact thing that I do in my new patient process and close big dentistry that way as well. But it's taking it to the next level. I had a patient who was a yoga instructor she'd been in the practice for 25 years. And we talked about redoing her entire mouth. And she actually was the one I was thinking of when I said, what is it that you have to think about? And she's like, well, now that you asked that, I don't think I have anything to think about. Let's just go for it. And it's like, had I just stopped when she said she needed to think about it, then that would have been over. As I go through that process with the team, we do a couple of days together in the office, and then I do weekly or bi-weekly calls with my treatment coordinator and the doctor, maybe on the same call, maybe on different calls, over the next 90 days so that it gets implemented. Because what I want is not to just be there for a couple of fun days, because it's fun for me to interact with teams and with patients, but it's to have the training stick. And so I want it to be sticky. And so I will do debriefs with the treatment coordinator. It's like, okay, what did you say? What did they say? What did you say? Or when they get stumped, it's like, well, I said this and they said this, and then I didn't know what to say, and it's like, this is where I was struggling. So, I want it to be a success, because what I really want is for the dental teams and doctors to get the love that patients will give you when you've changed their life. It's the most fulfilling thing that I have ever found in my career, is the way that they love you after you've changed their life. And so I feel like that's my calling, is to be able to give this, to have more dental teams be able to experience the connection, the love, the raving fans in the community, because we've taken them from 0 to 100 and totally made a difference. And maybe created someone who was super scared to someone who loves coming now.
It is an amazing experience. You just reminded me of a full mouth case that I did for a lady who was the mother of one of my patients, and she brought her mother in, and she had some previous composite veneers done elsewhere that had deteriorated, and so we replaced. It was just an upper arch in 12 crowns, I think.
Yeah.
And
Just 12 crowns.
spectacular result. Just spectacular result for her. She was,
That's great.
she wasn't 80. She was very close to 80. The sad part of the story was that 6 months after we did this, she passed away. And when her daughter came in, we were so disappointed to hear that she had passed. And her daughter said, you know what? She was so happy with her teeth. This was the best 6 months of her life. And
I have had that. I have had that same experience with patients multiple times over the years, where we have gotten the most incredible thank you notes from the family saying they had 8 months to live, or they had 1 year with their new teeth, and they were able to eat anything that they wanted. They were able to go out to lunches with their friends, and it was the best decision. So it's like, you can never count them out, no matter how old. The oldest patient I've ever worked with that we did Invisalign, 92 years old. And she was as spry as the day is long. She was hilarious. And she's like, it is finally my turn, and now I finally get to the smile of my life. But at 92, do you think most dental offices would even present that treatment? Probably not. But because I sat with her and we talked about what really bothered her about her mouth and what she'd always wanted, we were able to deliver that in such a cool, fun way that, I don't know, she may still be alive today, but it's like, what can we do to make a difference? If you've got that mindset, how can I make a difference in someone's life today? And it's the next patient, the next patient, the next patient, that I have that opportunity. It will change the patient's life, but it also changes your life. And that's the fun part for me. It's like, as much as I give, I get back tenfold, for sure.
And why should they be deprived of it just because they're old and maybe they're not going to get the life expectancy out of themselves that matches the life expectancy of the treatment?
Right.
You wouldn't say to your aging grandmother, look, I know you're 92. You don't really need a new refrigerator. Just get an ice box and put ice in it because you're not going to last the life of a refrigerator. You would never say that to her. Or a new TV. No. So why are we doing that about their health and their teeth? Why are we judging? Everybody should be given the opportunity to improve themselves as much as they want.
At whatever age, right? At whatever age.
Exactly.
And the fact that we let them choose versus us judging or choosing not to present, ideal treatment, ideal comprehensive care. I believe that every patient deserves the very best dentistry has to offer. And it's on us if we don't provide that opportunity for a patient. They get to say yes or no. They're at choice. So, we can always edit the treatment plan down, but not the other way around. It's like, give them the opportunity to say yes to the very best that you can provide and then see what else is available to you and to your team. It's super cool.
Exactly. Dee Dee, we've come to the end of our time. We're at 57 minutes. Thank you very much for your time today. If anybody wants to get in touch with you, any of my viewers or listeners, what's the best way for them to reach you?
They can reach me by email or on my website. So my email is deedee@amplifieddynamics.com. My website is amplifieddynamics.com. And there's a way to schedule a time with me on my website.
Well, I hope people do start reaching out because, again, this is a part of dentistry that you're not taught in dental school. Most dental school is just fix what's broken and one and done sort of dentistry. But my biggest turning point in my career was 1992 to 96. I flatlined in my office. Like it was just level. And I said, there's gaps in my book. And I said to people, I could be busier. And they go, you're already doing double what the average dentist is doing. You're going okay. And in 1996, I met a dentist who was doing double what I was doing. And he was in a lower socioeconomic area than me. And I go, he's no better dentist than me. What's he doing differently?
What's he doing?
And what's he doing? How is he doing that? How is he getting those results? And so that was my change. You know what the difference was? He had a coach. That was the primary difference. He had a coach. And so
that's how we all get better. Yep.
Of course. You can't do it on your own. You don't know what's out there. The coach's job is to give you all the more options.
And to see your blind spots. You can't see your own blind spots. And so, having a coach has changed my life many, many times over, all throughout, high school, college, and in my career. So
but more importantly, Dee Dee, being a coach is changing the lives of dental officers as well. And for what you do for dentistry, I think the whole profession should thank you because you're opening their eyes to what truly is possible.
Thank you. Thank you so much.
Well, thanks again for being a guest. I've really enjoyed this. Really appreciate your time.
Thank you.
Thank you for tuning in to another inspiring episode of the Ultimate Dental Podcast. We appreciate each and every one of you for being a part of our dental community and joining us each week on this incredible journey. If you found value in today's episode and you don't want to miss out on future episodes packed with expert insights and actionable strategies, here's how you can stay connected with us. Firstly, hit that subscribe button. Whether you're listening on your favorite podcast platform or watching on our website, subscribing ensures you'll never miss an episode. Secondly, share the love. If you know a fellow dentist or colleague who could benefit from the wisdom and knowledge that we share here, please share our podcast with them. Also, please share the podcast on your socials by simply clicking on the social icons wherever you view or listen to this podcast. Together, we can all do our bit to elevate the dental profession. And finally, stay engaged with us. We love hearing from you. Your questions, comments, and feedback fuel our mission to provide the best content for your professional growth, your personal growth, and for your practice growth. Remember, your journey to creating a dental practice and a business life that you love is our mission, and we're excited to be your trusted guide along the way. Thank you for being a part of the Ultimate Dental Podcast. Until next time, keep smiling, keep striving, and keep on tuning in to the Ultimate Dental Podcast.